Welcome everyone to the InterSim 3 simulator overview. In this first picture, you'll see here is our InterSims 3 simulator itself connected to the external pacer box that we use here at Mass General Hospital. So that's how the InterSim simulator will look like on the outside. This is a screenshot of the InterSims uh, monitor or the home screen when we have it on the computer. This is a better screenshot just to give you a good visualization. Note that this device can be used for implantable pacemakers and ICDs, but for our purposes, we will focus on the external pacer box. On the left side, you see that we have the abilities to change parameters like how often the atrial events occur or the ventricular events occur. And we can also change, let's say, the PR interval. There are other intervals that you can change, but for our purposes, we will not focus on that. On the right side, we see the EKG over here. You can choose to see leads 1, 2, or 3. You can see all of them, or you can just see one of them. You can also choose to see A or RV events, but that's a little bit more advanced. Over here, you can click on these buttons that you can throw in a PAC or a PVC on the right side or the left side, etc., just to sort of throw the learner for a loop if you were trying to use a simulator to try to reflect normal patient presentations. And our next screen, we see that there are benefits to being able to change parameters as well. So here we can, from this drop-down menu, you can see that you can change the rate, you can change different intervals, you can also cause far field sensing, or you can vary the degree of how much a PVC or T-wave amplitude would be, which again can mimic the variations that we see within our own patient population. Here you see a menu for changing the rates from each of the three more well-known intrinsic pacer spots. So from the atrium or the sinus node, the AV node, and then ventricular, you can just cause them to be at different rates. Here you can see that we can change intervals. This one will focus, of course, on the PR interval. We know that a lot of our post-cardiotomy patients tend to have prolonged PR intervals. We can also, if you see on the next slide, change the rhythm up. So we can't usually start with a sinus rhythm, but you can change it into all different types of rhythms, which can affect the way we can pace a patient. And certainly that can help with learning about troubleshooting when these various rhythms occur. And of course, what is a pacemaker if we're not using it for a block? And so you can mimic various different types of blocks, cause a bundle branch block, so as some sort of high-grade AV block, and see how their manipulation of the pacer box will affect how the patient will be paced. And finally, we can vary up the amplitude of the atrial and ventricular signals, as you can see here. And so this is one way that we can change it up for the learner for them to learn how to test for sensitivity thresholds. We can also change up the pacing thresholds so that when someone is checking pacing thresholds, we can vary it for them so that they can find more of a challenge instead of just a single standardization. And with this, we can use a simulator to help teach them all these basic pacemaker concepts before they even touch a patient.
And one of the big advantages of the simulator would be that one could play around with knobology, like turning on these buttons, turning this down, without actually practicing on real patients, which would allow safe learning as well as efficient learning. One could practice this over and over again in order to get it just right before they can start trying these maneuvers on someone who's real and someone who could actually get hurt. Here's an example of how we can use the device to help someone learn how to check pacing thresholds. So first, the examiner would set whatever the loss voltage would be, and so we'll hit apply. You can see that, let me close. You can see that our ventricular rate's at 60 and we have an EKG of 60. And so if I have them turn up the rate to, let's say, 80, we'll see on the EKG that we start having capture, as you can see on the top over there. And then what they can do is they can start turning it down. It's at 3, and we still have capture. 2.5, still have capture, but we lose it at 2. Now, of course, the person practicing would only be able to see the pacer box, but they can use this as an instance of learning how to check pacing thresholds.